In Fraser Health, a hospice or hospice residence is a home-like place that provides specialized care for people living with a life-threatening illness during the last weeks to months of their life. Whole-person, compassionate care is provided to patients, their families, and friends. We attend to physical symptoms as well as the emotional, psychosocial, and spiritual needs identified by our patients and families.
What it's like to be here is peace of mind. I could not live at home by myself, and coming here means I have help and I have interaction because I live alone.
The hospice residence is different than the hospital and other health settings, both in the way it looks and feels and in the kind of care that is provided. There is more focus on individual comfort, dignity, and choice.
There's something about this place that you felt safe. I felt looked after. I felt nurtured. It's not just the people in it. The people in it are unbelievable. It's also the atmosphere in the place. It's just, it sounds weird to explain it that way, but there's something in the air. There's something that just says it's all right, it's going to be okay. And the support that is given to not just myself, but to my family.
The activities in hospice are flexible, not as structured as in other healthcare settings, and the environment is calm. We want your family to make themselves at home. Friends and loved ones can visit any time of the day or night, and your pets are welcome during the day. Tea, coffee, and light snacks are available by donation, and family may bring in food for themselves and their family members. There are even accommodations for family members to stay overnight. While you are cared for in hospice, you have choices about whether you want to stay in to visit family and friends, or to go out with them for activities and events. When you are feeling well, you may leave the hospice for lunches, dinners, family events, and even overnight passes home. The staff will work with your family to make the plan for these outings. Privacy is provided in a way that is not possible in a hospital setting. Most, but not all rooms, are private, and staff is very respectful about entering your space, conscious of providing privacy for patients and their loved ones.
I can talk to anybody, the volunteers. I feel like I really know the family across the hall. Yeah. No, I've never met Linda, the woman that's here. Her husband and her daughter have become very close friends just over the last couple of weeks, and we can talk, and it just feels so much better. You can relax, and everybody's in the same boat here, and
there's a sense of community.
Yeah.
You go out just to get more ice for Mom or to get a cup of tea for us, and there's almost always somebody out there that you can just chat with. And it's not long, it's just, you take a couple minutes, but you don't feel alone. And that's really nice right now to have that. You just feel supported.
Your daily care will be provided by the nursing staff. They are knowledgeable about common needs and problems at end of life. Your medical care will be directed by a doctor who will visit regularly. A family doctor or a hospice palliative care doctor is always available around the clock by phone. Consultation with a palliative doctor is available if symptoms are not well managed. The nurses are also supported by a professional team that includes a social worker or counselor, clinical nurse specialist, spiritual care practitioner, pharmacist, and specially trained hospice volunteers. We want you to be as comfortable as possible.
There's wonderful pain management. Whenever you need something for pain, it's there. And that helps a great deal because at a time like this, that's what you're most concerned in. What you're most concerned with is the pain and suffering, and it eases the pain and suffering.
I have been encouraged. I've had some rough times where I've met some patients and you get friendly with them, and all of a sudden you notice they're gone, and that bothers me at first. And the staff were always right on it and right able to see that I was being hurt or that it affected me, and they were right on it and they helped me get through it. And so the staff here have been nothing but good. They've made this a home for me. Right now, this is my home, and they've made it a home.
Hospice care focuses on living life to the fullest extent possible while supporting your end-of-life wishes. There are opportunities for discussion of your hopes and fears with staff and specially trained hospice volunteers, in addition to your family and friends. The staff and volunteers are here to support your family as well. There are also opportunities for joy and laughter.
The staff are fantastic. I remember I think it was the second day Mom was here, and the nurse came in and said, "Now, Sally, I feel like I don't know you very well because your daughters are doing so much for you." She said, "Do you mind if I sit down and just chat with you?" And she must have stayed for 15 minutes getting to know her. There were questions about her grandchildren, and she talked about her grandchildren, and they weren't just questions. She was very compassionate and wanted to get to know Mom as the eloquent hero that she is. And in these past, I guess we've almost been 3 weeks here now, I've learned more about my mom because she can relax and she feels comfortable, and it's just a wonderful place.
My quality of life. I think my quality of life has improved because I feel healthier since I've been here. It's very strange to say that I'm here for a reason. We know what the reason is. And yet I feel much healthier mentally and emotionally. And my spiritual needs are taken care of.
We want to find out what is important to you and support opportunities for you and your family to spend time doing what is meaningful to you at this time of your life. Your family is welcome to gather at the hospice for meals or to spend special holidays with you.
It's a chance to be with family in a way that I could never be with my family otherwise, because there is no pressure. No one's worrying about getting the next meal or anything like that. It's just time to sit and hold hands and laugh and cry and look at old photograph albums and memories. If there's any that can be described as a gift in all of this, it's the gift of time, positive, good quality of lifetime with the people you love the most in your whole life. So, what greater gift can you ask for?